Greetings, my name is Selena Ahmed. I'm an Associate Professor of Sustainable Food Systems here at Montana State University in the Department of Health and Human Development. I also co-lead the Food and Health Lab, as well as serve as the Director for the Translational and Biomarkers Core of the Center of American Indian and Rural Health Equity. Today, I wanted to share some research highlights from the past year. All of us have had to shift our efforts, our approaches, our methodologies in response to the COVID-19 pandemic. Today, I wanted to share about some of those efforts. Back in March and April last year, I got together with community partners that I had been collaborating with here across the state, with an emphasis on the Flathead Reservation of the Confederated Salish and Kootenai tribes to start CSCAN Montana, or the COVID-19 Surveillance Community Action Network. And the goal of this network, it was to provide integrated outreach and COVID-19 surveillance measures in tribal and rural communities in Montana. We were specifically focused on tribal and rural communities, as these are health disparate populations that are particularly vulnerable, given that they have higher rates of chronic disease that are known risk factors for severe symptoms and morbidity from COVID-19. And we started our efforts of CSCAN with a community needs assessment. These are 4 of the highlights from our community needs assessment that many of us have become familiar with. First, there was a lack of diagnostic and surveillance testing and understanding which testing strategy works best for which specific context, whether we're doing diagnostic testing or whether we're doing surveillance here on campus. There was also a need for more clear information, as there were many misunderstandings and misinformation that's been found among individuals and communities with regards to COVID-19. Also, many community members expressed that there's a lack of culturally relevant and place-based public health messaging that they can relate to. And another major need that emerged was the need to improve food security in the context of shocks to the food system. And so since the spring of 2020, I've been working on addressing some of these community needs in collaboration with other investigators across Montana State University, as well as community partners across the state. These are 3 examples of awards, collaborative awards, that I've been involved in over the past year. For example, we were awarded a CARES Act grant for expanding screening capacity to enhance Montana's COVID-19 response capabilities. We were also awarded a grant from the National Institute of Health on protecting our community through home-based COVID-19 testing in American Indian communities, as well as Latino communities in Yakima, Washington, in collaboration with the University of Washington. And this work has involved a mixed methods approach across disciplines. We've been doing lab-based analysis, clinical trials, community engagement, as well as multiple social science methodologies, including focus groups, surveys, and interviews. Now, I just wanted to share a few images and products from this work. This is an example of some photographs that were taken last July at the Flathead Reservation. And these are images of carrying out COVID-19 antibody testing among migrant cherry workers, as well as surveys and outreach. This is an example of our place-based public health messaging to be more context-specific for our state. A major need that came up in our community needs assessment was how to interpret COVID-19 test results, and what to do if you tested positive, or what to do if you test negative, and what are the next steps. And then we've also created a range of public health material of sort of day-to-day risks. And so this over here shows, if we do choose to gather, what are some things that we need to know about lowering our risk. In addition to direct COVID-19 outreach, we've also expanded our outreach, our community outreach in other ways. For example, this is an example of curriculum that I've collaboratively created as part of one of my existing NSF grants on the water, energy, food nexus with Susie Taylor, who's also in our college, on providing curriculum during the pandemic to students that they can do at home. And so this is taking findings from our research, creating outreach material and activities for students that they can carry out when they're not coming to school. And so thinking about unique ways and new ways of outreach and things that we can take beyond COVID. And so ultimately with CSCAN Montana, we hope to make COVID-19 and public health messaging more accessible, particularly for the underserved populations in our state to help stop the spread of the virus. And our sort of long-term goals are, in addition to our immediate goals of providing public health outreach material and enhancing COVID-19 testing strategies, is really to inform public health guidelines, to inform future preparedness efforts, as well as food system guidelines to inform future preparedness efforts. I didn't talk very much about our food system efforts. In addition to these more COVID-19 testing and outreach efforts, I've also been involved in understanding how the pandemic is impacting the food system from production through consumption, including food security here of students at MSU. I look forward to sharing those findings at another time. Thank you so much and wishing you all a wonderful new year.